Thank you so much for joining our session, Why a Disjointed Approach to Health and Wellbeing Isn't Working. My name is Wolfgang Seidel. I'm a psychiatrist and I lead workplace health consulting at Mercer. And my colleague, Jenny Kirkwood, leads financial wellness at Mercer. So we are thrilled to be here, and I don't know who chose the title. It sounds terribly negative because we're only talking about what isn't working, but don't worry, we will very quickly move to what can be done and what does work. So, firstly, we are postulating that there is a big link between mental health and financial wellness and a number of other issues. So we are deliberately making a lot of reference to the Mental Health at Work report that we launched together with BITC just last month. And you all know what BITC is. It is the Prince's Responsible Business Network, and it's a report that is now in its third year and has been conducted by YouGov on our behalf, and there were 4,000 participants, so it's quite significant. Now, what we will be talking to you about is the influence on mental health that that people encounter in our workplaces. Since the report is in its third year, we have also added a special focus on financial wellness that we will be discussing with you today. And in addition to that, also a focus on how the mental health experience of minority communities is in the workplace. Now, over to you, Jenny.
Right, so kicking off, we thought we'd start off with some questions because then it gets everybody energised and focused. So, what proportion of UK adults have less than £100 in savings?
But have you downloaded the app yet? You haven't.
In which case, can we do it by a show of hands?
So let's do it conventionally.
Let's do it conventionally.
Let's do it conventionally.
Let's start off with 40%. 30%. 20%. 10%. Would you be shocked to know that it's actually 30%? On to the next question.
Okay, the next question. What proportion of employees feel able to discuss their mental health with their line manager? Okay. 76%? Okay. 56%? What about 36%? And 16%? Oh wow, you have read the report, isn't it? Very, very clever, well-informed audience. It's only 16%, can you imagine? So 16% of people feel capable of disclosing their mental health issue to their line manager. Now, what does that mean, though? Because we are meant to make reasonable adjustments for our employees who are suffering. How can we do that when we don't know? And we will also tease out in our conversation today what might be the barriers for people to come out with their mental health issues in the workplace. Jenny, can we move on?
Sure.
Go to the conventional presentation.
Yeah, thanks.
Technology is not on our side here, but that's probably one of the reasons why people are so stressed in the workplace. Okay, here we are. Now, we are arguing that urgent change is still needed because you can see here that 61% of employees have experienced a mental health issue due to work or where work was a contributing factor. But just 16%, as we have just discussed, feel able to disclose to their line manager that they have that mental health issues. Now, many reasons why people might be worried about talking to their line manager about mental health issues. One of them is written here, that 11% of respondents who did come out with their mental health issue were either disciplined, demoted, or dismissed. So that's a significant figure, though. Yet the trajectory is positive because last year it was even higher than that. It was about 15% last year. So 11% of those who do mention that they have a mental health issue have experienced a detrimental effect in the workplace. Now, and 30% of managers say they don't have any facilities in the workplace to help people with their mental health issues. So here are two significant reasons why people would probably struggle. I mean, if you think about it, and you will see it later as well when we talk about people's willingness to disclose their financial worries. I mean, if you don't trust that your employer has good systems in place, why would you disclose something that has no positive impact other than spoil your reputation, if you like, right? Now, let me put that into context, because one of my arguments that those of you who have read the report might have seen, or in other media, is that we must stop dividing human beings into two halves for mental health and physical health, because it hasn't been working. And in the most extreme terminology I can put it is we have built a lot of hospitals for bodies without souls and other hospitals for mental illness without bodies. That hasn't worked. That's that Cartesian dualism that has been around for a couple of 100 years that has indeed not helped us very much. So it makes sense to contextualize everything we say about mental health by saying how is it linked to overall well-being. And for that purpose I want to introduce to those of you who haven't seen it yet in the FT another study that we have done, which is Britain's Healthiest Workplace together with Vitality Health. What we do there is we measure, based on people's lifestyle choices, on their risk factors, etc., what's their effective health age as opposed to their chronological age. It's just another way of saying what's my risk of getting a heart attack or any other form of disease, but we put it in terms of how many years you are older or younger than your chronological age. What you can see here, it's 4 years and 2 months that on average UK PLC's employees are older than their chronological age, right? So it's just another measurement of saying how healthy or unhealthy am I. What you see here is the usual suspects of bad nutrition, of smoking, of lack of physical activity, chronic conditions, etc. Another reason, of course, is alcohol consumption, which is fairly high. It's about 30% of people who exceed government guidelines on alcohol consumption. Now, what's interesting here as well is we want to know what's your motivation to change. And what we find is that we are living in a wellness culture. People say, yes, I want to lose weight. Yes, I want to exercise more. Yes, I want to eat more healthily. But for now 5 years in a row, people say, I do not want to reduce my alcohol intake. So that's quite an interesting psychological insight as well. And it's important to you, if you plan health and well-being programs, do you want to go for something that people are motivated to change, or are you going for the low-hanging fruit? But the reason why I put up that slide is more to do with bottom left here, because bottom left you can see that people are, that how what I was arguing for just before is linked together, namely financial well-being, mental health, etc. If you think of somebody who has financial worries, they would obviously be stressed, and that's in that little case vignette here. If they are stressed, they would be sleep deprived. If you're sleep deprived, you wake up the next morning with those all too familiar carbohydrate cravings, and you start eating the wrong type of food. That's just a hardwired process that comes from our brain. And if you eat the wrong type of food long enough, you might predispose yourself to diabetes type 2, which is probably the biggest ticking time bomb amongst chronic diseases in the UK and in the Western world. So you see how it's hanging together, and how you would at least have to have a biopsychosocial approach to health and well-being to do justice to it, and to also look at mental health as something that needs a pragmatic clinical pathway so that it gets destigmatized. I think all the efforts of destigmatizing mental ill health that we have seen, and thanks to all the celebrities and the royals who have spoken about mental health, they are great, but they are not reflected in the figures yet. That's a sort of atmospheric culture change. But what will help us with destigmatization is one day when we have mental health programs that are as practical, as pragmatic as physical programs are, then we will destigmatize mental health. And last but not least, there's a huge number of days of productivity lost when you add it all together. Now, This one is, for once, because I have done my duty to Mercer, which is a consulting firm that forces all its consultants to talk about statistics and show confusing tables. So I have done that now. So I can now talk about mental health in more general terms. And I went recently to this Picasso exhibition. Some of you might have seen it in the Tate Modern. It was called Picasso 1932. And I saw this painting, which he calls The Rescue. And I thought, well, that's about mental health, really, to some degree, if you like. So I could use that as a background slide to talk about mental health and destigmatization. I put forward one argument already. I believe that we need clinical pathways that are as powerful as they are for musculoskeletal disorders for mental health. And then we will achieve much more. And it is a win-win for the employer and the employee. But there's other points to consider in terms of culture change. The way we talk about mental health. You know, we tend to say, oh, she's depressed or he's a schizophrenic. Really? We don't say he's a knee or he's a broken leg, right? So in that sense, what we do with mental health is we have a use of language that suggests that it can't go away. It is now part of your character that starts to define you for the rest of your life. That's nonsense because, you know, in everything in medicine there are some diseases that are temporary and we have treatment for them. So that's certainly something we have to consider as well. And the last point I make here as well probably is why do we always construe mental health so differently from physical health, also in the sense that it is such an abstract concept, you know, something, oh my God, mental health, we don't know what to do about it. When in fact there are reasons why people suffer. And some of those reasons we have alluded to. They don't have enough money, or they have been bullied or harassed. Let's not forget what we have learned over the last 18 months or so from the Me Too movement. What we have learned there is that there are good reasons why people, particularly women, would be distressed in the workplace, because it's not a workplace that is necessarily conducive to their well-being when they get harassed in that sort of way. And there's many other reasons that we could look at. And if we go to the causes of mental ill health, we would do a much better job than just lamenting over the figures that we are seeing. So the key concerns that I was talking about is 35% report that their financial situation is negatively affecting their mental health. But 56% of employees do not feel comfortable sharing their money issues with their workplace. Does that remind us of anything? Well, it's a little bit similar to what we just talked about in terms of mental health. So it's another taboo subject. And yet, I would say I'd be willing to talk about my financial situation, no problems. But you know, you have spotted it. I have a continental accent. We are quite direct, and particularly when you go to the north of Europe, people can Google what their neighbors are earning. You know, when you're in Norway or in Sweden, everybody knows what everybody is earning. That would be a culture, not a culture shift. It would be a culture shock to us, wouldn't it? But I think that figure is quite rightly so high, because what does my company do to help me with it? If I don't trust that there are services in place that are meaningful, of course I wouldn't just talk about those issues. Now, you can also see on the next stat, and I'm not reading it to you because you see it in front of you, that young people fare worse than the average aged employee. That shocks me as well, and that concerns me a lot, because, you know, we talk a lot about the lost generation as well when we discuss issues of young people not finding jobs or not getting onto the housing ladder. So now, unsurprisingly, that also has an impact on their mental health. Similarly, I was talking about minority stress earlier on, and I, to some degree, would also think of women belonging to that group, even though they are the majority in society, because of what I said before, that women can suffer more from harassment than men do. So in that sense, I think it falls into the same category. But what you see here as well is that members of the LGBT plus community are significantly more likely to have a mental health diagnosis than the average employee. Jenny.
But that's only half the story. Financial wellness, we've got a big problem. I mean, we started off, you know, it's 1 in 3 are just about managing financially. 17 million UK workers have got less than £100 in emergency savings. Now, that's a broken boiler away from financial catastrophe. And you can all imagine quite easily a financial issue that's going to be £100. 26% relying on credit cards to get by, 39% expecting to work beyond their favoured retirement age. We've got problems in this area, and 34% report that their financial situation negatively impacts their mental health. 21% say their mental health negatively impacts their financial situation. 66% of employees say that their mental health and well-being is affected by their personal job security and by the state of the economy. The two are inextricably linked. Touched on a few of these things on the previous slide. 17% of employees believe that their employer supports those with financial difficulties. Wow, that's a very low statistic. And particularly as now more and more employers are doing things in this area, but obviously the word isn't getting out to the employees what is available. So you combine, you can see that statistic is coming from, you've got the people not wanting to speak to the employer and the employer not necessarily publicising the help that is available. 90% of younger workers say their mental health is affected by the cost of living. There are things as employers that can be done. There's things that can be done to support employees in this area. Things like debt consolidation loans and things to help people through the more challenging times. Looking at the dimensions of well-being, Wolfgang?
Sure. Well, now, as we promised, we are bringing the conundrum together now, and we will try to offer you solutions. So if a disjointed approach doesn't work, then how should you think about your employees in order to design comprehensive health and well-being programs that speak to all their dimensions of well-being? So I mentioned briefly biopsychosocial healthcare. That's always being hailed as the latest of the latest. It isn't, because it was firstly postulated by the WHO in 1948, so it's not the latest as people might want you to believe. We conceptualize it as an 8 dimensions model, and we think of, yes, of people's physical, mental health, their emotional health, their spiritual health. That's not an anomaly, and that is not talking about things like religion or something. That is talking about purpose, something that is most important to almost any employee. Life at work gives us purpose and meaning. We have 2 major dimensions if we wanted to condense that into only 2 buckets. That is being able to work and being able to love. That's what grandfather Freud said, and that's why I'm using an Austrian accent today, because it's a speech on mental health. So it's those aspects. Social well-being is extremely important, to give people an opportunity at work to mingle, it's sort of, loneliness is one of the biggest reported issues in this day and age in our society. So work also is an inoculation to some degree against loneliness, and gives you structure to your life, a social opportunity. We need to think about it very carefully when we are thinking more and more about remote working and flexible working and how you manage people who are not in the same office as you. An intellectual challenge is absolutely important. Again, fulfilling is only work that is meaningful to you and where you feel that the locus of control is inside yourself and where you are not micromanaged by other people. So we need to bear that in mind as well. And the environmental factors are pretty obvious, that you want a safe office environment, a safe factory environment. But as a subset of environmental well-being, I would say one issue that all of us encounter is, of course, occupational well-being. What is our line manager doing to us that either stresses us or empowers us? You might have heard of toxic boss syndrome, right? These are those managers that are so wonderful at creating stress in their teams instead of containing uncertainty, which I think is the biggest psychological task for any manager, to contain uncertainty. Jenny, did you want to say something about financial wellness? You're saying it here, much more sophisticated.
So, financial wellness needs more than just a box on the previous slide. It needs a slide of its own. We view, when we're looking at financial wellness, there's really 4 main areas to look at. So that is having control over your day-to-day finances, being able to absorb a one-off financial shock, having financial freedom to make choices, and being on track to meet for longer-term goals. Now, today, with reward programs, we tend to focus on number 4. We also might have a bit of number 2 in terms of, so number 2 will have some, maybe a bit of life insurance, a bit of permanent health insurance. But in terms of supporting people, we don't really tend to have much in the control over the day-to-day finances. And being able to make medium-term goals, again, maybe saving for a wedding or, something significant, we tend not to be focusing in those areas. And if you speak to employees, they're not quite so bothered about the long-term pension, but they are certainly bothered about the managing day-to-day and the being able to cope with that boiler breaking. And the reason for the interesting circle roundabout is we're all on a journey, and we're all on different journeys. And the usual way of saying, well, I'll do this for my 20-year-olds, I'll do this for my 30-year-olds, just doesn't work. I'm 46. I am a divorcee and I'm remarried, and I have a 2.5-year-old. I have friends who graduated at the same time as me, and they've got children going to university, and they're still married for the first time. But, we're all on different paths, but if you came to me, the benefits that they need are very different from the benefits that I need. I could do with childcare. I could do with a night off. I could do with babysitting. But whereas they're thinking redecoration, I've got a spare room back. We're all in different places. And so we need to be thinking about tailoring the benefits so that they are available for people when they need them, but making sure they're aware that that's where they are. But what actually is needed? Now, we believe that the starting point for developing a successful engagement programme, a successful benefits programme, is understanding your workforce. There is lots of information that you already have on members, from permanent health insurance claims, private medical claims, to if you've got a flex benefits programme, what do people actually pick? Is the bike useful? Do people do the cycle to work? Or do they do what I did, which is I bought the bike and it's now called the garage ornament? So identifying the needs of employees from data, also things like focus groups. Find out what your employees are actually thinking, because part of the problem we have is it tends to be that people that are looking and designing the programmes for their membership and their employees aren't necessarily the same as their employees. And at that point I'll mention sample dashboard from health perspective.
Yeah, try stop me talking about data. Really, really important that we have a data-driven health and well-being strategy and not one that's driven by anecdotes. So one of the very tried and tested methods that we have used with a number of organizations is the health dashboard, and Jenny kind of described already what it's about. It's about interrogating data sets that seem to be telling you a contradictory story, because private medical insurance suggests that every big claim is to do with back pain, for instance. When you then look at group income protection, suddenly you see that mental health has overtaken musculoskeletal disorders. Then you look at absence statistics and people say, no, it's all wrong. What we really need is a flu vaccination program, because that's what they see, right? A lot of absences, short spells of absences for colds and flu. And so the storyline would be biased if we didn't cross-reference all data sets and bring them together in a consolidated effort into one data dashboard. And that's the health data dashboard that we have sort of briefly depicted in the middle. That's also your opportunity then to list exactly how much you are spending on which disease category, and start building your return on investment case if needed, or your business case in a wider context. We talk about value of investment more than return on investment these days, and that's the great opportunity. Now, what I'm working on right now is to do justice to everything that Jenny and I tried to say in the bulk of this session, which is to be even better at looking at this health data in the context of your demographics and in the context sort of the whole of D&I experience in your workplace and performance. So ultimately, we want to end up with a multivariate analysis of being able to say simple things like, this young woman who had an amazing performance review, what did that do to her health? You know, a few months later, was her health improving or deteriorating? Or somebody else, as a member of the sandwich generation, what did it do to their health, to his health, for instance, and his performance? So that's the tripartite multivariate analysis that we want to achieve, because that's really essential to do justice to your diverse employee population. I think that is enough for now, other than obviously actions then come from it. Oh, this is my other favorite subject, where we are really talking about ROI now a little bit. And what you do find there is very easy, a reduction in absence. That, of course, allows you also to infer the reduction in presenteeism. You know, if allegedly an elusive concept, what happens when people come to work but they suffer from a chronic disease and therefore they are not as productive as they otherwise would be. Not rocket science. You can measure presenteeism directly, or you can infer it from absenteeism. If you have a good capture of absence data, you can calculate presenteeism as well. Now, what you also get is, of course, higher employee engagement. You get higher productivity, of course, as well, and improved employee outcomes. And that's probably the most important part, that people are really feeling better and have an opportunity to maximize their potential. That is what we are all in the business of, right? It's not just to make more money on the bottom line, but also for people to be more fulfilled and to have what we discussed before, that opportunity to have purpose in their life and to succeed in those two most important dimensions of life, which is work and love. So if we go to the next and I believe final slide, here we are showing off a few data that have been replicated a few times in terms of what you can achieve in terms of ROI outcomes. So for instance, this is now referring to mental health claims. So when you introduce a mental health pathway, a very meaningful way of proactive and reactive services to mental health, so where you give people fast-track access to the right services when they do have a mental health problem, but where you also are trying to nip it in the bud by providing line manager training, by providing resilience work, etc. Then you achieve figures like 16% reduction in average cost of claims, nearly 10% reduction in the number of claims, and so forth. But most importantly, we found in our work with large organizations that 60% improvement of patient outcomes. And those are the two big things that you want to measure. People always say, how can you even measure mental health? And in most mental health reports, you find that people say it's an unresolved issue. It isn't. You can measure clinical outcomes as well as economic outcomes. And this refers to clinical outcomes. You can measure if someone has really improved from a person who needs mental health care to someone whose score is in line with the average population. So you can measure that. It's not rocket science. One word about line managers before we stop, because we had a discussion, Jenny and I, that we are not going to bash line managers here, right? One reason being because they are as stressed as the rest of us are, right? Line managers sometimes are a little bit more stressed because they are not senior management, therefore they don't have the extremely high decision latitude that senior managers often have, and the more decision latitude you have, the less stressed you tend to be, because as I said earlier, if the locus of control over your workflow is inside yourself, you are less stressed. But so they are often in that sandwich position where they are being stressed an awful lot. And yet, it's true that line managers have been promoted purely on their technical skills and not their people skills. It's true that people think you can't learn empathy, and yet you can. Having trained thousands of psychiatrists and psychotherapists, I can tell you can train empathy. It takes just a couple of hours in role play to help people understand how to see the world as good as they can from another person's point of view. And that's necessary because we have all individuals at work. So line manager is a good attempt to improve the situation, but it can't be your only attempt because they have a tough life. And I'm saying that because some of you may have seen, like I did this morning on BBC Breakfast, that our good friend Professor Gary Cooper was interviewed, and he did almost only offer that one solution: line managers have to change. And it sounded like all line managers are incapable of doing a good job. I mean, that I would like to question a little bit. I'm sure he knows the whole science around it and all the other solutions, but I don't just want to say that it is all about line managers. Jenny.
And as a line manager myself, I agree with that. Give us some good tools, we'll use them. And I just finally wanted to mention about, on the financial wellness side, you'll see at the top, 33% increasing their pension saving. You'd have seen in the slide earlier, we were saying about when you put things in place, try to make them personal, try to make them so it's easy for people to do things. Now, that was a programme we tried out in that we sent people personalised videos to do. It was effectively their benefit statement, but put in visual form. And we used some imagery of, this is where you are. If you increase your contributions a bit, you might be able to get a better house and a better car and a better life. And at the end of it, there was a simple click, which we had linked up with the company's pension fund website. You clicked through, off you went, you could increase your contributions. 33% increased their contributions, and I must admit we were actually really rather chuffed with that, because normally we've done things like this before but with paper, and you normally get 5 to 10% uplift, so to get 33, we were pleased. I hope we have put across here today that we need to be holistic in our approaches. Doing one, another problem is just going to pop out. We need to be thinking broadly across mental health and financial.